Let's talk about endometriosis and egg freezing. Now, we know that endometriosis is a common condition affecting women's reproductive age, often leading to pain and reduced fertility. As women delay childbearing, the question is how best to preserve fertility becomes an important option. And egg freezing is one of the options, but its effectiveness in women with endometriosis has been clear and the evidence generally has been limited. So, this systematic review, which we are presenting, which was in RBM Online, analyzed 10 studies involving 1,100 women with endometriosis who underwent egg freezing. The main findings show that the number of eggs retrieved is the highest in younger women and in those who did not have ovarian surgery. Surgery for endometriosis, especially the ovaries, can reduce the number of eggs available for freezing. Interestingly, the type and size of whether one or both the ovaries are affected by endometriosis did not consistently impact the number of eggs retrieved. In fact, the quality of eggs measured by how many reached maturity was not affected by previous surgery. There remains a major gap in research and in terms of follow up. In fact, it is known that many women who freeze their eggs do not return to use them, and the actual birth rate from frozen eggs, though increasing, is not as well documented. The best outcome means the higher chances of pregnancy were seen in women who froze their eggs by the age of 35 or younger and have not had ovarian surgery. For these women, the live birth rate using frozen eggs were about 46%. For women who had surgery or were older, the chances were lower. What does the review tell us? The review highlights that egg freezing is not a guaranteed option for everyone, and especially with endometriosis. It works best when it's done early, when the woman is young, before any surgery, and may require multiple cycles to collect enough eggs. And that's a difficult option. There's also a need for more research, and it truly benefits the costs and the impact psychologically that has on egg freezing. And while it means that egg freezing is a valuable option, you have to be realistic at how many eggs you can obtain and what are the chances of pregnancy with that.